check the preparedness of any company or any organization or the response agencies or the responders, how they respond, what are the parameters they have to follow, what are the things they have to consider during the response time. Because as we all are discussing, disaster is basically three, four type of spectrum. It includes pre-phase, during phase, and post-phase. So during phase is also important because at that time, if we have planned properly and we have did some good exercise in the past, then we can very easily mitigate any kind of disaster which will come into picture during the natural cause. So for the introduction part, in recent years, emergency planners and managers have employed various type of exercises in the development and testing of contingency plans and response capabilities for a wide range of emergencies. Talking about chemical emergencies or chemical disaster or chemical terrorism is somewhat tough than other man-made disasters and natural disasters, because we know the SOP, what could be the impact, and we know the process. In case of chemicals, in particular, we don't know because of the properties of chemical. For example, if we are talking about a persistent chemical and the chemical is also producing some toxic fumes. So depending on the environmental condition, it is tough to ascertain what will be the impact. So it is very much required. We have to prepare a contingency plan, and most of the companies, most of the organizations, even government bodies prepare. But how to test the contingency plan is very much important, and how our agencies respond, and how we will cross check the response capabilities. So in this case, a number of these exercises have been conducted with the support of national, local agencies as well as support of private industry, especially through the efforts of chemical manufacture organizations, or we can say the units which generally import, export, or use chemicals. Many committees have reported that they are confused by the existence of various type of exercises and are often unsure as to which type of exercise will meet their needs. Obviously, because certain companies are following companies are following different types of materials. Certain are different, so it is very much required. So we have to focus upon this part also. This lecture will provide an overview of the major exercise types and describe some resources currently available for conducting exercises. So overall agenda will be that only. How will we focus upon this part, and how to conduct the exercise. So essentials of emergency services is a very big thing in case of chemical industrial disaster management. So a chemical emergency exercise is a distinctive type of directed activity with the following essential elements. What elements are essential, what to focus upon, how to focus upon is a big concern in case of industries. The trigger event of the exercise is a simulated hypothetical incident that generates problems for participants. The participants are representatives or principals of some most or all of the major organizations that would respond to an actual emergency, including first responders, hazmat teams, medical personnel, public works personnel, emergency services officials, city managers, and elected officials. The issue in these cases is that whenever we go for the emergency exercise, we have to make a multi-stakeholder team. That means we cannot leave any team per se, and we have to integrate. We have to focus upon some hypothetical accident. Why we cannot say that this is going to happen? We have seen the examples of Bhopal gas disaster. We have seen the Vizag. Yes, we all are prepared. Not in case of Bhopal, but in case of Visakhapatnam leakage, we were prepared. But then also issue came into picture. This is the thing. We are trying to go for a hypothetical accident type of thing. The participants generally solve the problems presented to them by using existing plans and operating procedures, activating emergency response systems, and or developing equipment. The role of PP is the role of exchange. See, generally what happens in the government scenario or the current scenario, all the industries, whosoever falls in the major accidental hazard units, wherein they are handling some hazardous chemicals, so they have to make a on-site plan of their particular company. Why we have to make them on-site plan? On-site plan generally gives a brief description about the chemical we are handling or storing, and what are the mitigation strategies, what are the antidotes, what are the first aid measures. Everything is there in that case. What happen if fire will take place, what happen if flammable material catches fire, and all these things are there, so that we get the scenario that okay, up to this context we will be able to control the situation. Parallelly, after making the on-site plan, wherever MH units are there or industries handling the chemicals, hazardous chemicals, the district officials have to prepare an off-site emergency plan. So, off-site emergency plan contains basically all the chemicals manufacturing units within their domain or the district. So, say for example, one company is producing A chemical, certain B, D, C, F, whatever is there. So, the offsite plan of district comprises of all the hazardous chemicals in particular document. So that in case of any emergency with these chemicals, we can go for the mitigation strategies, we can go for the response, we can go for the rescue part. So in that particular sections where we make an on-site plan or we make an off-site plan, we have to incorporate the response mechanism. Generally, what we write, okay, if 100 tons of chemical got leaked, this is our response mechanism. But how to test is a very big thing. And during the essential exercise, we use this actually documents emergency response, or if we are using a PP, it is workable or not. Only making bare planning is not sufficient. Why? Because in case of emergency, is it workable or not is a big concern. The problems are presented sequentially, and each problem requires some type of response by the participants, whether it be in the form of discussion, written messages, or actions. So whatever is the input, but yes, we try and we want that every contributor or every stakeholder should contribute in this exercises. These responses are generally related to one or more emergency activities. Example, coordination of response units, fire suppression, emergency medical response services, triage, movement of the vehicles, and number of activities which we have to focus upon. And these all are very important ingredients of an emergency exercise. So it is very much required that each step, for example, you want logistic support. You say there is a mass casualty event due to a chemical leakage, and you have to say cordon off the area. Then you have to provide relief, provide resources to the material, provide the food, logistics. If there is a temperature is cold, you again have to mobilize the people to a safe place where the temperature is normal. So all these things are very much important in case of an emergency. Just giving you example of the flood case. When you see flood comes to a particular village or a tehsil, you will say the people are being migrated to some higher altitudes. In that case, they are not. The government migrate them. Government has evacuated. It is not only the evacuated and then we have left these people to any road or so. No, it's not like that. The overall scene, we have to evacuate. We have to provide eatables to them. We have to provide safe drinking water to them. We have to provide tents to them. We have to provide some cloths to them. Everything we have to provide medicine. So coordination of all these things are there. And then they have we generally the government or the system provides the mechanisms that the human being or the person whosoever is migrated or evacuated can be lived life properly until the situation goes back to the normal. So all these things are there. So how we do this in case of chemical? Yes, it's a very haphazard type of movement. In that case, we have to focus upon each and every small part because the life of responders are very critical. Those whoever is going for the response part, again their life is also important, and people, obviously the community is in danger. So we have to mobilize them, then we have to decon them, then we have to provide them the medical facility, what type of food they required after the exposure of chemicals, or if not about the exposure of chemical, is there any psychosocial effect on this community? So every parameter should be there, and all these things are enlisted in the emergency exercise plan, or say on-site plan, off-site plan of the respective districts or the companies of the MH units. Now, difference among the exercises. What is the difference between a chemical and other exercises is very much required. In addition to the shared exercise elements listed above or the last slide, there are important differences among the various type of exercises that can be employed in emergency preparedness. Talking about the off-site plan or the on-site plan, they generally quotes about the hazards related to chemical which is known to them, but there are certain other hazards which can come into picture due to the failure of the earlier hazard. For example, you have prepared for the chemical part, only for the fire precaution was there. You have made a plan of the fire rescue, fire mitigation, and unfortunately, you are seeing that okay, spillage and leakage is also witnessed at the site. So these are things are very much important. Exercises can have differences in purpose, scope, level of stress, types of responses, or actions required for participants. In case of purposes, the purpose of emergency exercise range from training and familiarization of participants with their roles and responsibilities to a rigorous test of contingency plans and response capability. So it is much required that we to understand about all these things. I have already quoted about this thing, contingency plan and response capabilities. So contingency plan again, it should be very much documented. And what is the response? How districts are responding? How the response agencies are responding is very much important. By scope of the exercise is meant the number of functions to be exercised or the depth of which functions are examined. So what functions, as I told you, the mobilization or movement of the mob or evacuation of say 1,000 people from one place to another, where we have witnessed the chemical leakage or say chemical contamination. So again, we have to size n number of things. I have already quoted food, shelter, water, medical, everything should be there. So we have to examine all things. Among the functions that can be sized are prevention and control, warning, incident assessment, containment, everything is there. Whatever is there. We don't want that chemical show is ill effect in to more people. Exercises can deal with one, several, or all functions and or some or all the activities associated with each function. So we can say that one function, only the mobilization or mobilization was very much linked with other things. Mobilization include evacuation is there, then fooding, drinking water, and all these things are there. Third point is stress. The exercises impose varying degrees of stress to participants. In low stress exercises, participants are given fairly simple problems and ample time to solve them. In high stress exercises, the problems are numerous, complex, and presented in real time. Talking about the actual scenario, as a part of National Disaster Authority, we have conducted a number of mock exercises, number of real exercises on the airports, on the seaports, and metros, and at very remote locations also. What we have witnessed, for example, if you're talking about this part, say Gujarat part, so we have generally tried to devise the mechanism or the SOP, or we have built the scenario कि it's a very hot temperature, and what temperature it should be around 45 degree temperature. We will choose the day when the temperature is around 44 to 45. We will choose the time 12 to 2, and we will choose that water is also not available in that particular location. Why? The worst case scenario should be addressed because it is a high stress exercise. You have to, the responders, response agencies have to tackle with, first of all, we have to go for the exercise part. Second, heat stress is there. Second, body will not function properly. There is a issue of dehydration, and all these things come to picture. So whosoever the participants or responders have to face numerous and complex issues during the exercise part. So stress is level too high, and it is very much recommended that whenever we go for the exercise, we go for the worst case scenario so that we can check the potential we all have during the response time. Next is the actions. Participants in the exercise may be asked to respond orally to problems, example to discuss responses or actions that they might take, and or verbally walk through a process. So because why we are quoting all this thing during the mock exercise itself, I'm giving a real example. If I say for of our participant, just we have to lift a per person whose weight is around 50-60 to say 100 meter, you all will witness that it is simply impossible to lift a person in one go to 100 meter or 200 meter. In case of emergencies or disasters, it is very much tough. That is why we want the responses. If I say, okay, can you lift this a man of around 50 kilo odd weight? So this the participant has to decide. Yes, I can lift. I can go for the evacuation part. So this is the thing, simulate actions that they would take without actually deploying personnel and equipment to the scene of accident. That is, example, activate the communication system or provide technical assistance, or simulate all actions that they would take in emergency, including those at the scene of incident. For example, they have to cordon the area, they have to assess the situation, they have to go for the triage part also, and then they have to inform the responding agencies also. So all actions are there. It's not about that the person who is so is a responder go and say, okay, just give a glass of water to these people, they all are okay. In case of disasters or chemical disasters, it is very tough to ascertain what actually they want, what actually is the reality. So exercise planners create different type of exercises by combining variable of purpose, scope, stress, actions in their ways. They collect purpose with scope, stress, and activation. Club all these things in one go, add so that we can get a new type of exercise, and we can actually exercise. See, we cannot say any app or any robotic type of material or any software can simulate the actual human potential or the capacity of human resource. In case of emergency disaster, particularly chemical disaster, it is very tough to ascertain all the things. Why we are going? That is why we generally go for the exercise part, recommend mock size to check our accessibility and our capacity to fight any disaster or emergency situations. Now there are three types of categories for major exercise, that is tabletop, functional and field. So we have to focus upon three parts. One by one we will take tabletop, functional and field. Before starting for the tabletop, I just quoted list of emergency response functions, a broader concept of emergency response functions, which include whatever things will be included in case of exercising the our capability or assessment of our potential. First, initial notification to response agencies, how we go for the notification. When just think about that part, if on-site emergency plan got failed and certain amount of chemical leaked in the community or the population, obviously the district administration has to respond, and how we'll notify to all other agencies to coordinate direction and control, communication among responders. Again, it's a very big thing how to respond, because we all are capable, but how we will communicating. Just giving you example of a cricket match. If two players are batting and one person is taking the run, other one is not responding properly, what will happen? He will get run out. Eventually, the team will be in loser side. So communication is much required, that whatever is work is assigned, it should be done on a prompt way. It's not like again communicating whatever you have communicated, bring some fuller's earth and he is bringing some other material. So this is much required. Warning systems and public emergency public notification, whatever is the mechanism, we have to follow this. Again, this is a important function. Public information, community relations. Yes, with the why I have written here community relations. Generally, as I have put it in earlier lectures also, community participation is a very big role in case of any disaster restoration situations. Why? If you are having a cordial relation with the nearby communities, nearby people, then it is very easy to mobilize. It is very easy to coordinate. It is very easy to fight with any disasters. Community is the first man who will come into picture to help you out, and community is the first group of people who are affected. So you just think community is going to help themselves for any effect of disasters. So what is the relation of the industry with the community? Because they are the persons who are affected and they can help you out in case. Health and medical services, what are the capabilities of our response mechanism, or do we have enough antidotes in our surroundings? Human services, do we have enough manpower? Fire and rescue, provisions of fire rescue are everywhere in the industries. But yes, how to use this? Are they, for example, there is a hot sphere and hot sphere is having benzene and type of thing. It got leaked. Does the automatic fire hydrant system started? So we have to cross check all these things. It's a very important part of emergency response functions. Personal protection of citizens, indoor protection and evacuation. If there's certain people are trapped due to any accident, due to blast of chemical tank, high pressure chemical tank, how will you protect them? How will we evacuate them? Where to evacuate? Where is the safe zone? Where is the law enforcement, police and mechanism, or your in-house security services? Are they able to cordon up the area? All these things. Ongoing incident assessment, outer situation. On incident assessment is on both sides. It is the right and left side. Why I'm talking about incident assessment? It is very much required that incident should be clearly assessed. Sometimes what we have witnessed in our actual scenarios, that the incident is very low, but we have been communicated that it is very heavy consequence, this thing in certain things incident assessment, the impact may be very high, but we have communicated okay there is small leakage. Next is resource management. Whatever resource we are available having, public works, containment and cleanup, documentation and debriefing. So everything is there. Why we have written documentation, debriefing? After any accident, we go for the incident investigation. We debrief the people. We have to submit the documents to the government so that it should not be repeated. If there is a mistake type of thing, or if there is a malicious practice, so all this will come into picture. So we have to focus upon all the part. Just for the figure part, we have satellite control center, rescue helicopter, disaster area, police, volunteers, rescue team, every fire truck, hospital, doctor. Everything is integrated with each other. It's not like that they all are using playing a independent role. So all these things are list of major emergency response functions. Now going for the tabletop exercise. The first category of exercise is basically tabletop. I have tried to put a table over here where people are sitting, or say stakeholders are sitting. As it is a multi-stakeholder, so everybody is there, industry is there, district administration is there, police, doctor, fire, everybody was there in this thing. The distinct characteristic of the participant action is in all table exercises talk, that we have to discuss too much. It is not that we ascertain, no, I am a very learned, qualified, experienced administrator and I was working for past 30 years. Whatever I'm delivering and saying, it is quite correct. It is not like that. In this case, we have to focus upon the individual thought process. Why we have seen in certain scenarios, the operator of the plants are quite talented and trained. They know what could be the consequences because they are witnessing the same process for past 20, 30 odd years. So they know very well if this type of thing happens or occur on actual, what is the consequence, how will be the impact, what they have seen in the past. So everything come into picture, and when they talk, they will definitely say, which will range from informal responses to questions about emergency situation to verbal. Walkthrough of process and procedures is again a thing. Tabletops are generally low stress activities, usually held for the purpose of training, familiarizing participants with plans and procedures. So, in case of tabletop, generally the exercise coordinator or the coordinator brief each and every participant what is the plan, what is the emergency response plan, what is the on-site plan, what is the off-site plan. Just give a look on this thing. If you want to add, all the stakeholders, whosoever is not informed, they also will come up with good ideas and they will say, okay, sir, we will do this and this is the issues. We have to make them very comfortable. It should low stress activities. Only just scenario point. Yes, we are going. It is not actual thing, and we focus upon that part. In case of tabletop, generally we find that differ significantly in scope. As we have seen the scope part, we have seen very clear number of functions. In case of number of functions, scope will cover, say, after the discussion, people will say we have 10 functions. No, we will focus upon two functions only. We want to test two functions or three functions or say four functions. Only we are focusing upon the evacuation part. We are not able to put on the area. Only we will say everybody evacuate. Have assembled a particular location. So this is the best practice or right idea, and all these things comes picture. In tabletop, focuses is on one, several, or all major response functions and may also differ in depth to each function is exercise. So it could be, as I said, they say focus on one function, two function, or entire function. It depends on, because we have a multi-stakeholder group. You can see over here, if we have a multi-stakeholder group, everybody will say and come up with good ideas, and they will say. The principal out of table is to highlight problems in broad response categories such as communication or traffic control. In this group, they have thought okay, the communication is the biggest problem in case of chemical leakage, and somebody will say traffic control because chemical got leaked on the road and complete vicinity community is coming to issue. So tabletop will say, because the thought process there, 10, 20 people are coming with the idea who are experts in their field, so they will say no. As per my experience, this is the right way, and we can go with this particular solutions. Next is the functional exercise. It is the second major category of exercises. It is basically a simulated exercise with no actions in the field. It is only a simulated exercise with no actions on the field. The dominant feature of this category is the actual performance of some or all of the actions that would be required of participants in an actual emergency, except those activities that are performed at the scene of the incident. This means again it's a situation where we are discussing that okay, in this we have thought I will do this, I will do that. This particular group of responders will go for the medical part. This particular group of responders will go for the evacuation. They will provide the PPE, they will provide the antidotes, and they will transport the victims to the right place, or they will do the zoning, hot zone, warm zone, whatever. So this thing again is a big issue, and participants basically focus upon the important parameters, and they will think these are the functions which we have to focus upon. Functional exercises tends to have a moderate to high stress and often focus on a single function. Example, direct and control, directions and control, providing technical assistance to responders. In tabletop, we have come up with all the ideas, but in functional exercises, we are focusing on certain group of tasks which we have to focus upon, we have to cross check. Similar, it is basically what we say in our technical terms is hazard operability, wherein we go for one particular node of any process industry and we check. I'm just giving you an example. For example, there is a flow, laminar flow in a pipe, and everything is quite good. After a few times, there are certain softwares in industries, PLC and SCADA. You all have heard definitely. So they will show the variation. The flow is meant, the pipe is meant for say streamline flow, but it become turbulent at some point. It will show an peak over there. Then we will understand there is a vibration, there is a turbulence in that particular thing. So focus is always the direction control. That is the software is meant it should be going in this direction, and it has shown some fluctuation. So these all things are very much focused. It is a single function. Only we have to check the streamlining or turbulence. Streamlining there, everything is okay, and if turbulence is there, only we have to replace that particular section or area from this thing. It is basically done in the industries with the tool called HAZOP, hazard operability of a particular industry or node. The purpose is generally to test planning and response capabilities of personnel and systems without actually deploying response equipment. So it is very clear that we have to focus upon these things. This exercise in the category include field exercise, regional response team simulation, and emergency operation simulations. But whosoever is there, we have to focus upon these particular parts. How the region is responding, how the EOS emergency operation center COCs we can say exercise their techniques. Third is the field exercise. Now in the tabletop, we have thought something process. We have thought about different functions. In the functional, we have focused upon the function part. Which function we have to focus? We will focus particularly this time on the evacuation part, or particularly on the coordinating, containment, or providing antidotes. This will be focused. And the third major category is the field exercise. The dominant participant activity in the field exercise consists of response operations conducted at the site of a simulated emergency. Field exercise involve all or most emergency response functions. You know very well, whatever you plan, whatever your emergency plan says, it will not be coordinated as you have thought. It is very tough to maybe some responders are quite efficient that they go for the proper, because in case of disaster in particular per se, when where we are not having a exact figure of victims, where we are not having exact loss, exact damage, it is very tough. Number of people are victim, number of vehicles got damaged, number of installation got break, leak, all these things are there. The common purpose of field exercise is to provide a rigorous test of emergency capabilities of the total emergency response. I'm not saying that entire plant is collapsed, entire say tanker of chemicals, we have say 100 tank forms, and each and every tank form got blast. It's not. I'm just focusing, or the responders are focusing on the failure of say one or two tanker which is having a hazardous chemical, can be leaked to community and can be hazardous to a certain population. Only we are focusing on that part. So we have to cross check the emergency capabilities of the responders or say ourselves by going on the field. Response equipment is deployed. For example, we have PPs, we have ambulance, we have police vehicles, we have fire tenders, everything is there. Realistic scenarios are used, medical personnel and equipment, including operating rooms are included, and plant managers and other industry employees are participants. Because these events involve key community group agencies, these exercises often elicit media attention. Media is important role, and they can cross check, because you know the system scenario. Wherever we go, they will say, they will cross check, they will try to cross check what is the actual scenario. We have witnessed certain thing in certain airports. Media people come to us, rush to us, sir, the exercise was good, but the capability or the assessment is quite low, and we can see that the percentage of capability or capacity assessment is on the lower side. What happen if this type of scenario comes into the airport? How will the government respond? How will the airport authority respond? How will the private entities respond? So all these things come to picture. Asking the media or giving information to media is also good, but on a lower side. Okay, this is only a dummy exercise, and we are trying and testing the thing, so that no unnecessary message is being communicated to the community. Why we are communicating? Exercise in this category include giving you example the NDRF also. You have seen the NDRF people mobilizing here and there, but the first incident is cross check the local police, also the local government officials only.
सर
Then they,
पीपीटी
yeah, tell
शेयर
me.
पीपीटी शेयर करना है
Repeat that.
क्योंकि अभी नेटवर्क का इश्यू है कुछ स्टॉप शेयर हुआ है
ये वाली PPT, this PPT, have you seen this PPT?
Yes, sir. Yes, sir.
Field exercise you have seen, na? Okay.
Yeah, yeah.
So I was just speaking something about the field exercise, wherein I have tried to tell about the scenarios what we try to achieve from this type of exercises. So you can see the equipment deployment on the real basis. It's not like it's a dummy thing. If we have ambulance, we will deploy the ambulance. We will evacuate the patients or the victims from the site only. In this, we just keep a hospital prepared and we do all these things. So the category, we will go in the field and we will assess the situation on the ground, full scale, with all our capabilities, with all our resources. Whenever there is a scenario, everybody will role play in the same way. Those who have assigned the role and those who are competent in that particular domain, drill and field exercise. And last is a local response team exercise, which I have quoted, that local team are the first who come on the site and cross check the incident. Then only they propagate the information on the higher authorities. Now, description of hypothetical size. Yes, we all know that it's in hypothetical size only, and we are assuming that this can happen. So, it is not real, factual, confirmed, actual, definite, proven, truthful, certain, sure, and concrete. So, by this figure, we can easily understand that everything is hypothetical. Nothing is going to be real, no fact finding, nothing, anything can happen, and we have to focus on that part. So the following capsule descriptions of a hypothetical chemical emergency exercise for each of the categories may help to illustrate difference among three categories. So we are trying to focus upon certain hypothetical this thing. Okay, just devising a particular problem, hypothetical situation, which is only assumption based. This could happen. We will focus upon, and how will we go for the tabletop, what certain things which we can focus upon is only the thought process behind this slide. So during the tabletop, the description are in the form of brief information bulletins that might be issued by officials of a hypothetical MAH installation. MAH stands for Major Accidental Hazard Units. MAH. So this is much important, which we have to focus upon. Major accident means the probability is more in this case. Hazard installations. Why I'm talking about major accident hazards means we know that the properties of these chemicals are on the upper side, means they are when we talk about the numbering side or how we go for the color coding or placarding generally given by NFPA, National Fire Protection Agency, are only five numbers. It is 0, 1, 2, 3, 4. So wherever people like us see the 4 number, we will say that okay, it is on the upper side of hazard, and wherever we see the 0 number written over at storage tanker or say container, we will ascertain that okay, 4 number is on the major side. That means it could be it is quite clear that it will create big problem. 0, yes, it is on the lower side, so no need to worry. So this is very much required that in case of MAH, yes, we already know major accident hazard units, so we have to practice on these installations only, so that we can easily review the plans. These descriptions provide information on the purpose, participations, location, scope, and activities of such participants. Again, as per ISC rules 1989, it is quite clear that the hazardous chemicals, wherever hazardous chemicals are being handled, there they have to make on-site plan. It is not like that everybody makes the on-site plan. Yes, but in my the thought that everybody should to make an on-site plan. Maybe they are they are not handling hazardous chemical, but then also hazards or is processed in the in their plants. So during a recent tabletop, I will just try to elaborate this thing. During a recent tabletop exercise, officials of a MAH installations reviewed the city's plan for responding to a major chemical emergency. You know very well, wherever is the industry, people are there, and population is there, community is there. So they try to review in their city's plan, or maybe you can say district disaster management plan (DDMP). DDMP is there. They have listed all the things. Or in case of offsite, if there is a MH unit, then district's offsite emergency plan. So senior managers of police, fire department, the city's new hazardous material team, representative of Red Cross, local hospital liaison, and the field commanders of all major response units conducted informal discussion of actions and their units would have taken if this had an actual emergency. So all the people, I'm just written certain, there are n number of people depending on the emergency. There could be transportation people also. There could be agriculture people also. So every officer and team, they sit together and they conducted informal discussions on the hypothetical exercise which we will focus upon. The discussion covered the full range of required responses to such an emergency. So they have plotted some hypothetical situation, what all things are required. Everything they have tried to conclude on the tabletop itself. They will sit and they will ascertain, okay, these are our preparedness. And if you are talking about, say, 10,000 tons of fluorine got leaked or methane got leaked, what is our response mechanism? A brief evaluation lessons learned period followed the exercise. So we generally, we have quoted our people from cities, hazard teams, fire departments, they know they are handling situations on a daily basis. They know this type of accident, what would the impact, how to go to the hospital, and all the things are there. This was a tabletop. In case of functionals, officials in MH installations report the completion of a major test of the city's capabilities to provide emergency medical services. As it's a functional, they are focusing upon the emergency medical services to affected populations following a major leak of highly toxic chemicals. So they have focused upon the medical services emergency part and a major leak of chemical. Test focused on the local XYZ chemical plant on Avenue and nearby neighborhoods. Participants in the exercise included the city's emergency services, director, officials of public health department, or Bayside Hospital, and medical emergency units from the fire department. Whatever is there, they're focusing on that part, and as if it is a functional exercise, they have to focus upon the functional part. Okay, function is what function is required. Provide medical emergencies is the basic function in this case of scenario. This is the only thought process. Emergency medical services. The emergency activities of interest in this test included the coordination of responses, management of the resources, and identification of the medical requirements arising from such an emergency. Now, the question will arise here: major leak of a highly toxic chemicals. What is the name of the chemical? What could be the antidote of the chemical? What are the properties? It is an irritant, a nerve agent, or it has the properties showing nausea, headache, vomiting, everything is there. So we have to focus upon all the parameters. What category of chemical is being lead, and it is a major lead. Do this chemical, is this chemical flammable? Do it have the property to become sensitizer? What all things are there? So we will focus upon everything along with the coordination of responses, how the fire department is being coordinated, how the relief forces are responding, how the rescue forces are responding, how the police is coordinating of the area, how the medical this thing are getting the path, because the basic function is the emergency medical services. But each and every stakeholder has certain role during the response part. So it is very much evident that we have to focus upon this part parallelly. Participants simulated the activation of emergency warning systems and the city's new emergency medical system response system. So they have forced the activation is there, and how they will respond. They have made a zone or not, or for example, in planning, say in the plan, medical response system says that we are able to help you in 10 minutes, or our ambulance will reach at site after the incident within 15 minutes. Are they able to reach? Are they able to come from the crowded location? Are they having some relief? They have the petrol filled, they have the tire pressure maintained, they have the complete setup in the ambulance itself. If they want oxygen, it is there or not. So these are things. This exercise may also be functional exercise. For purpose of this analysis, we have listed field exercise, and evacuation was conducted by key participants following the exercise. So functional exercise there, and we will focus upon the important parameters. Third is the field exercise. City officials announced today the completion of a major test of the city new emergency operation plan of chemical accidents. Okay, so they have started and they have told we have a concrete, we have a robust emergency operation plan for accidents. We will not fail in any case, and we have made the plan. We have tested and checked. The test involved all major offices and departments of the city with responsibilities under the plan, including the mayor's office, the police, the fire, the medical, public health, emergency service department, as well as a representative from the army and red cross. So what they are quoting in the field, that they have done all the things, and after cross checking they have concluded that all the parameters are in place. We are able to follow, we are able to ascertain the situation, we are able to we have completed task as we have devised. Whereas
Slides are not showing,
as
sir. Slides are not showing. Last two slides.
okay.
We missed last two
We
slides.
missed last two slides. Now it is visible.
Yeah. Is a description of hypothetical exercise.
Yeah, yes, ma'am. Hypothetical exercise. So in tabletop, we were discussing, and I have already quoted about the what all things we are planning, how to go for this thing. We have all the stakeholders sit together. They have discussed that yes, it is not a factual or real scenario, but if certain thing will happen, how to respond. In functional, yes, we have focused upon the report and what we have quoted and discussed that it's a functional exercise. And our main agenda will be emergency medical service, provision of emergency medical services to the affected populations following by a major leak of highly toxic chemicals. Function is basically we will restrict ourselves or focus on a particular node that yes, we this time we will practice the emergency medical service mechanism to the affected population. How they will respond, how this thing will there. So we have to focus upon all this part. In this, we will cross check the activities of interest, that is coordination of responses, management of resources, and identification of medical requirements arising from such emergencies. Participants simulated the activation of emergency warning systems and cities knew what I have already explaining about a commitment which made by the cities on a hypothetical that yes, we have a very good system and we will reach the site within 10 minutes with all the equipments and we will cordon off the area or we will say save the victims. So this is the thing functional that we have thought of. Third is the field exercise wherein the city will say that they have today completion of a major test about the new emergency operation plan for chemical accidents. For example, generally we quote, yes, we have tested and we have made a mechanism, we have made an SOP or we have made an application which says that we are quite efficient to handle any chemical accidents. So test involved all major offices, maybe police, fire, medical, administration, logistics, everything is there. So everything has been included and we can see easily they have tested various aspects of emergency response were tested, including directions and control by officials in the EOC's coordination of all operation at the site of the simulated accident, the local plant on emergency installations, and all operations required to suppress the simulated leak and treat all affected persons in the plant and nearby residential area. So during the field, if you can cross check the starting from the direction and control by officials, because again, as an incident commander, one will be the leader and he will try to head the complete scenario. How he will sit in the EOC, obviously, he will sit in the EOC, what we call as incident response system. He will sit in the EOC only. How he has coordinated and simulated the accident. Again, we have seen the scenario that a major chemical got leaked, and what we have to the function was a movement of emergency medical emergency vehicles. This was the basic thought process, and we have to focus upon that part. Following the evaluation, an extensive debriefing was held and evaluation of the site will be prepared. And following the evaluation, the officials will revise the city emergency plan and operating procedures. It is a very big term. What I would like to highlight is revise. See, earlier if you see, it basically say hypothetical exercise. Okay, but commitment was that they have conducted a major test and they are confident their emergency plan for chemical accident is quite workable. They have included all these people. They try to assist the incident commander and they have coordinated all the operations at the site. Then also, if we are finding lacuna or gap in our plan, it is okay that yes, what we have planned we achieve, but again we are focusing on a very small or single unit. For example, we are focusing upon only a emergency medical movement along with the leakage. Now the thing comes, what if the chemical affects the responders only, because we have this team. Yes, this team is working, this complete team is working and they are focusing on certain important aspects, but it could, how we have ascertained that all these people are safe and they are not the victim of any chemical. Right now they are quoting, okay, we have tested and as per our SOP we are on right note, we have this. Worst case scenario is that these all people have coordinated, they have tried a dummy this thing and only a few material has been used that shows the property of a hazardous chemical. So this is again a big thing which requires the revision. In case of revision, we will try to incorporate all the odds which we witness. Okay, we have called the doctors and paramedics, and in the site we have what we are witnessing that the triage is being done by a doctor. Triage generally, you are a disaster professional, you must be knowing triage only a mechanism to filter out the victims on the priority, which group of victims requires movement to the hospital, which requires a minor treatment or first aid is sufficient. Somebody will require a big thing, and somebody are of no use, they are already dead. So this is required. So what we have witnessed on the side, that triage is being done by a doctor, and you will say, okay, it's okay, doctor is doing a triage part and paramedics are sitting idle. Generally what happened in case of disaster scenarios, rule is fixed. The triage part or the fixation or the prioritizing of the victims is done by the paramedics only. We have one doctor, he's quite efficient, and he has to prescribe the medicine, he has to tell the antidotes, he has to give the first role is of doctor is to treat these people. But we have seen on the side that okay, treatment is another part. He has started triage. Okay, you this group of people will go in the hospital, this will not go in the hospital, and all this come into picture. All these scenarios we have to devise, and the who are the evaluator of the exercise, they go for these things, they cross check everything, what role is been assigned and what actually you are doing. Or my MD says in Siki, no, first of all, this group of officials are my say priority people, you treat these people, and they have started treating. So small inputs is much required, and in case of evaluation, we have to write all these things, that endurance in the process was has been observed, the victims was not properly triaged, doctor started triaging movement despite of in spite of treating, he is filtering out the victims. So on the basis of these things, so all this picture will come in the field exercise, and we will monitor, we will say, and we will make a say note of say 100 50 100 odd comments, and then we try to revise the our emergency plan, what we call an offsite plan, or say DDMP, or district disaster management plan. So this is also field exercise. Now, what are the uses of these exercises in the planning process? The local planning teams complete four major tasks. So again, when you have exercised the field, you have come up with the ideas, it requires revision or it is okay. Generally, what I personally visited and conducted mock exercise in many big installations. Even I have conducted a mega model for one of the largest refinery in the world. So we have, just for your knowledge point, I will try to put. See, we have devised certain scenarios, and we were very happy that we everything was completed as per our thought process. And finally, we have seen that one particular scenario has not been focused. See, we have tried to filter. We have to focus on four different scenarios. There is a leak, there is a terrorist attack, there is a road accident, and there is a crisis in the hospital. Also, COVID is there. So we have focused upon three parts. First, we have mitigated the leakage. We have reinitiated the medical part. We have properly transported the people. But we have, unfortunately, we have forget one scenario, that we have also devised the scenario of terrorist attack. And what we are seeing in the after the debriefing session, that four people are coming, sir. You have told us to go and implant a bomb in a tank form, and nobody cross-checked. We had implant after 15-20 minutes. I came back. Nobody witnesses. This is a very big failure. 90% you have achieved. Only 1% is sufficient to ruin the entire planning process. So that is why it is much required that whatever we are planning, we have to cross-check, and what are the other vulnerabilities are coming in the scenarios is also cross check. So after the points, after the debriefing, whatever is the recommendation of the evaluators or the team or the stakeholders, then this will help in reviewing existing plans. If there is a plan and it has been made by a very good consultant who is having a good command on English, so he has written a very good English words, but what actually we want as a responder is missing in that. English is very quite good, and he has also decorated document, but is it for our use or not? Because we are failed. Test activities came into picture and we failed. Assess current response capabilities to respond to chemical emergencies, develop an emergency response plan for chemical accidents, and revise, exercise, and update the plan. This is very much required, update the plan. And generally, people thought once they have made a plan, submitted, it has been vetted by the government body, and nobody is thought. Generally, for the private entities, I am quoting, because they are the custodian of the chemicals, they are the manufacturer, they are the users. So yes, government is there for each and every aspect for the community, but they have to exercise their plan. They have to update the plan if required. If they have introduced a new chemical in their industry and that is not known to the district administration, it is the responsibility. It is also a legal responsibility that they have to they to tell this introduction to the district industrial safety and health department. So parallelly, they will tell to the district commissioner or district magistrate. So exercises referred in the four tasks can be useful in the completion of planning process. Reviewing existing plans. Exercises provide insight into how response functions would actually be carried out under existing plan. Generally, what happened, what I've seen, people assign role, multiple roles to a single head of the office. Sir, this is the AGM Saab, he's the general man Saab, so he will have certain roles. They don't go for this particular part. Ki GM will not go on the ground. Again, if he's an incident commander, or say our district administration, district collector, this thing, he is not the person who will go on the site. We have to protect this decision maker also. So he will sit over to but if you have given a task, logistics will be provided by the DM only. DM is a very big thing. Forget about that. You just focus on the general manager. In private industry, it happens. The general manager will say, I had to give the command, or I had to arrange the logistics, or I had to provide the antidotes, what I have to do. So this should not be there. It should be on a very clear note. An existing contingency plan can be tested by presenting exercise participants with a simulated chemical accident requiring a simulated response based on the provision of local plan. Again, as we have understood the Sendai framework and Sendai framework priority 1, localized plan which depends upon the local scenarios, local issues in the listing. Use of an exercise is more often, sorry, use of an exercise is often more effective in many cases than a review of the plan by a single planner. This is very, as I already quoted, a smart consultant with a very good command on English will make a document, maybe it workable or not. It is very much difficult to ascertain, but we never ever say go for the single planner. A person sits on a computer, cut, copy, paste from other plan, make the plan. It's not accepted at any, and the 99% case, this plan will fail when actual scenario comes. Exercises are also useful in obtaining input and expertise from variety of people from different agencies rather than from a single planner or set of planners. When you go for the exercise part, you will say the community whosoever is residing in the area, they know the place very well more than you. They know where to go, where to move. You have all witnessed the Uttarakhand disaster, the Kedarnath disaster. At that time also, the families of Indian Army and BSF, all these people evacuated themselves because they know how to respond. They have seen their family people going up hills and how to save these people. So this is a scenario which we have to focus upon. But a planner or a consultant will never tell you, okay, in this scenario where you have to go. So this is our plan. We have to make workable as per our requirement. Field exercises provide the most complete review, and they are most useful when plans are relatively complete and formal. Table type exercise can be used effectively in communities where resources are limited and existing plans are less complete. This is very much important. Result of these exercises can be used to revise and improve plans which lack sufficient provisions for chemical emergencies. Yes, they can say, sir, this was the mistake of driver, or accidentally he did something. This is a mistake of an operator. Due to this thing which happens, we are importing the chemicals, it got leaked, what to do, and all these things are there. But we have to focus upon all these things. Go for the existing plan reviewing after the mock size. We will focus upon this part. The planning teams may be either a local emergency planning committee or the local authorities. Local people, yes, obviously, as per Sendai framework priority 1, we go for the localized part only. Second is assessing capabilities. Assessment of current capabilities is a major task of a planning team. An assessment identifies gaps in resources and readiness that need to be addressed in the planning process. Produce an inventory of resources with the community, example, chemical containment equipment, fire apparatus, hospital beds, and identifies the level of preparedness of response units and systems in the event of serious chemical accidents. Generally, what happens in case of chemical scenarios, we witness that a big chain of reaction is required within a community because we don't know what type of antidote is required, what is the response mechanism. If we focus on this part, we can easily mitigate the thing. And this is the capability assessment also. After the exercise, we will assess how our team is responding and on which note they have done all these things. This assessment can be done through exercise designed specifically to test current capabilities. Exercises can uncover potential capabilities and weakness that are often overlooked by the other methods. It's not like that my boss has said you have to make and you have made. No, it's not like when an open field you work, you focus, you coordinate. In case of mock, you will see different type of things on the scenarios. Developing, revising, or updating the plan. One of the basic principles of emergency planning is that each planning team need to design its contingency plans to fit local circumstances. Again, we are focusing local circumstances, local circumstances. Yes, we have already seen the Sendai framework and local circumstances must required. We have escape route very clearly defined. We have where the population exists, where we can go and escape. All these things should be very clearly noted. Or do we have some rallies in that place, or we have some festival is there. So all these things are there, and at that time plan what we have to activate this plan. So these all things are very much required. All the elements of plan, example, required procedures, policies, coordination mechanisms need to be specifically related to existing resources, capability, and organization structure for a given community or emergency planning. An exercise is very useful way to identify gaps in existing emergency response procedures or to determine planning factors necessary for developing specific plans for chemical emergencies. In addition, an exercise can be a powerful stimulus for building interest in developing a comprehensive local emergency plan. Not about the chemical part plan, but yes, because we are focusing on the chemical part, it will also trigger certain other things, and we have to if we utilize the thought process in updating, we can also go for a good comprehensive multi-stakeholder local emergency or local disaster management plan. Major steps in developing a tabletop size. Again, there are certain steps which required. Describe the emergency response system to be exercised. Develop a clear statement of the general objective of the exercise. Use the statement of objectives to define the scope of exercise. Present the results of the first three steps to the leadership of the necessary participants organizations in order to secure their approval. Commitments of the participants. Define critical features of the accident to be simulated. Decide on the identity of all the tabletop participants. So generally, we have seen that decide on the identity. We have a group of multi-stakeholder people. We have DM sitting over there. We have SP sitting over there. We have say Tahsildar and all the senior officers sitting over there, along with MDs and all these people are there. In that case, we generally forget the emergency professionals whosoever is working over there. On that aura, we thought, okay, whatever they all are people saying. In that case, it is much required by the coordinator or the exercise coordinator that he should make a coordination between all these people. Maybe you have high post, maybe you have high position, but in case of scenarios, in case of emergencies, everybody is on the same level. We all have to do some contribute something, and we have to focus on all this part. Arrange for the logistical requirement, including space, exercise materials, setting arrangements, and develop the exercise material. Generally, we circulate all these things in advance, but in my opinion, we have to devise a scenario. We should sit together and go for the knowledge sharing. We have to use this as a knowledge sharing platform so that necessary input can be gathered in the tabletop part. In this discussion, we assume that the exercise leader or a coordinator of the team efforts has been designated by the local planning committee and that all the major steps are completed in concert with the key officials concerned with the preparedness and response. Although tabletops vary in their complexity, they all require planning and coordination. It is critical that problems that arise reflect genuine response capability problems rather than problems that may be due to haphazardly planning and coordinated exercise process. So now there are certain steps also which we have to focus upon, and it is required that if we use the steps, it is easy for us to. If we are not also there, we can tell them, okay, if we follow these steps, we can easily come up with a good idea. The description of the emergency response system should contain, at a minimum, the following: a listing of all major response agencies, fire, medical, police, etc., etc., the emergency response roles and responsibilities of each agency. It is very clearly identified. We have witnessed certain place. For example, whenever we talk about the chemical emergency and it will come into the it took place in a district, the deputy incident commander is always the officers of the Department of Industrial Safety and Health. We have witnessed in certain places in major refineries also what they have did. Okay, the fire officer is the deputy incident commander. It is the wrong process. It is not never ever put it over here. The responsibility is fixed as per the hazards. It is being identified as per the emergency. It is not a medical emergency. It's not a fire emergency. It is basically a chemical emergency. So, who is the competent person? Department of Industrial Safety and Health is the responsible agency. So, is the officer appointed here? He will be assigned as a role of deputy general commander. Next question we will ask how the system would respond to a major chemical accident. It is in the first describe the emergency response to be exercised. Again, it is important to understand how the emergency system operates. To accomplish this, the exercise team leader coordinator should consult all available plans, procedures, agreements to all the responsible agencies. Yes, we have to also call the mutual aid companies also. If we are planning it, say in X company we are planning, and we have 4 other units also there, we have to call people from these agencies also. Review prior exercises and reports on responses to past accidents and hold informal discussions with representatives of the major response team. It is not necessary for system to be outlined in formal plans, procedures for this step to be completed. If a formal plan do not exist, the exercise leader should identify an informal system of operating procedures that typically govern response to previous incidents. If you don't have the document also, you don't have the plan also, then also you can devise these things. Step 2. Develop a clear statement of general objective of the exercise. Clear statement, what you want, which you are focused upon. Virtually all tabletop exercises for chemical emergencies have the common objective of testing the capabilities of the jurisdiction of emergency system to respond to chemical accident threatening public health and safety. To this generic objective might be added something about the type and size of the accident and the emergency response functions to be tested. This must required example is this. The objective of the exercise to test the capability of cities, police and fire departments and emergency medical service unit to respond to a major chemical accident at a fixed facility in the city and to minimize the effect of that accident on the public health and safety. So it could be there. We have to focus upon clear part. What objective we have to focus upon? Are we talking about the chemical leakage? Are we talking about the chemical fire? Or are we talking about the chemical contamination in a particular area? So it should be very clear statement of the general objective of the exercise. Use the statement of objectives to define the scope of exercise. The scope of the exercise refers to a number and identify of response functions to be exercised and the depth to which any of the functions will be examined. For example, the exercise will test on the procedures for dispatching response personnel containing an accident and treating on-site injuries. Tabletop can deal with a single function, multiple function, and all functions required for a major response. Step 4. Present the results of first 3 steps to the leadership of the necessary participating organizations. This may be an interactive process requiring the revision of some of the results of the first steps. Maybe you found in this stage that it requires certain changes. Then in this step 4, we can go for the assessment of first state using the statement, scope, and objective, and they can we go for the commitment of other professionals also. Define critical feature of the accident to be simulated, which will include the nature of the accident which causes threat, facility or transportation route where the accident is occur, and characteristics of the neighborhoods threatened by exposure to accidents. The exercise scenario should be realistic and specific the kinds of release and a particular community is likely to experience. Generally, what happened? People say the chemical got leaked and 1,000 people got died. This type of scenario don't work. What we say only the community affected. Some people got major issues. Some people are not having major issues. So all these are things are required that we have to focus upon realistic and specific to of the kind of releases a particular community. Now you are saying that chemical is there and it got leaked, but it not reached to the community. And you know very well with the dispersion modeling mechanism that the chemical will not leak because the wind is not there and it will not be transferred. So go for the proper situation. The downwind is say north west and the speed is say 10 miles per hour and it got reached to a community where thousands of people are residing. Just imagine a scenario where chemical got leaked and it is an isolated location. None of the people stays over there. In that case, no need for this type of objective. So it is very required. Nature, facility or transportation route and characteristics of the neighborhoods threatened by the exposure of the accident effects should be there. Step 5. Decide on the identity of all the table participants. We have already discussed. The participants include all these people, departments. Step 7. Determine the identity and responsibilities of key personnel. Persons assisting in the conducting exercise may include a facilitator who will introduce exercise events into play of the exercise and facilitate the completion of responses. A recorder who will take the notes during exercise and collect materials, observer or evaluator who will absorb and evaluate the play exercise. Collectively, these persons constitute the exercise control group. Evaluator, it is a very important matter or observer. These are the person who will, the only role of these people, right from devising the scenario and debriefing and hot wash, is only that they are taking a pen and paper and writing the tick or ticking the yes no part. For example, everybody reached on the time within 5 minutes, they will only say tick, or we have called 4 5 tenders, 4 reached or not. So they will go for the evaluation part, and in the final, maybe with the help of software, we will go for the data analysis part, or by our knowledge, and we will check the reliability scenario. How reliable the data are they, whatever they are quoting is okay or not, and they will finalize all these things. Step 8, decide on the ground rules to be followed in the conduct of exercise. Tabletops are conducted mostly under clear set of ground rules. These rules typically control such matters as actions expected of the participants, how their decisions are to be reported to other participants and to the exercise control group, and the length of time to be allocated in responding to each event. It is crucial that these be developed in advance of the exercise and understood by the control group and the participants. The steps are quite clear. We cannot deviate by the highlighted steps. We have planned something, we have to go over there. Yes, it is a hypothetical situation, then also we have to follow the rules that we all have to mobilize to a certain location, or the assembling point is this: we have to assemble there only because we have prepared and we have maintained every logistic part over that place only. It is not that you have changed the plan and the complete exercise will be failed. Arrange for all the logistical requirements include space, exercise material, sitting. In this segment, all arrangements should be checked by a member of the exercise planning team who is designated as the exercise coordinator to make sure that they will support the exercise design. An improperly configured conference room can make the conduct of a tabletop very difficult as lack of key exercise materials such as maps and copies of plans. It can be very helpful to have a large map showing the accident site, the surrounding neighborhood, and the key facilities, such schools, hospitals, and potential evacuation facilities. All these things are required in case of emergencies. We know that each of the facilities or the resources required. Resources very much required in case of any exercise we're doing. Step 10, develop of the exercise material. The exercise material consists of generally three parts: the scenario, which sets the stage of the exercise, a sequence of events which stimulates the play, and the anticipated responses. So these three parts is very much required during the any exercise. The scenario is a brief written statement that provides an overview of the emergency situation. The scenario should contain the following: a brief description of the community and the facility and the area surrounding the facility, a description of the chemical accident that is triggering event for the exercise, and any other information that is important to the setting for the first event in the consequence of events. Example, the wind conditions at the time of accidents, casualties, exact location of accident. Generally, we plan that we are going to focus on only 10 casualties, or we will try to mobilize only 10 or say 30, say 50 people, because it is very tough. You just imagine the condition of your good self, that if somebody says to you, somebody says you just lift up a person and move to say 50 meters. It is literally not possible for people like us to lift a person and walk for 50 meters. And in case of disaster scenario, we have to mobilize the entire community. We have to cross check the victims. We have to identify the victims. We have to mobilize to the nearest hospitals, provide medical attentions, provide logistic support. So all things come into the picture. Again, the sequence of events is presented to the participants either orally or in writing, one event at a time. The events are arranged in a logical, chronological sequence designed to portray the essentials of developing. In this also, we will say, okay, first of all, emergency will say siren will come into picture, report from certain place come into picture. Somebody has reported you there is a leakage and 10 people got fainted. Second, emergency alarm got this thing, you will convert on site to off site. District admin will come, mutual aid resource will be tested, and all these things are devised. So during the division scenario development, we will say these are the sequence, right, from step 1 2 3 or 10, whatever is the steps, and everybody has to follow the same chronology because it is very much important. The event represents changes in the circumstances of the accident or in conditions over which the participants have no control. Example, a change in the weather or a major change in the rate of spill or leakage of the chemical. This can be integrated also during a mock exercise. If there is a weather condition, say rain is there, and you have not thought about the rain part, again it will create a issue. So you have to focus on that part also. And the event of sequence in this sequence should be directly relevant to the response functions being cited, the roles and responsibilities of the participants, the exercise objectives, and the local of the accident, tailored to the specific characteristics of an actual facility and community in which the accident occurs, and realistic, factual, and arranged in a proper sequence. In selecting the events of size, the exercise coordinator will find it useful to construct a set of anticipated response tied to the various events. These anticipated response can be used by the exercise facilitators and evaluators as a standard against which to compare the actual responses during the tabletop. For example, they have already witnessed certain exercise and they have seen the response time of an event. They have tested in the last exercise, the same type of scenario was tested, and within 2 hours we have completed exercise along with the medical provisions. We have admitted the victims, we have treated the victims, everything is there, and then they will try to correlate with the this response times. These standards are not shared with the exercise participants in order to ensure realistic responses. Our overall objective is to check our capability and assess our capacities during any response time in case of chemical emergencies. So how will we respond? We will respond with either a document which is available to you. In the past we have exercised certain things, or we will make a set of standards. Okay, this is the time, and we will compare in this way. Anticipated response actions may be derived from relevant contingency plans or standard operating procedures used by one or more of the participating organizations. If plan or procedures do not exist, the anticipated response measures should be developed and written down prior to the exercise, constructed logically from the circumstances being simulated or identified through discussions with response personnel regarding their informal operating procedures. So we have to, if nothing is within, we can go for the anticipated response measure. You will evaluate, or the evaluator will evaluate. Okay, I thought, and as per the documents or assessment documents, the complete exercise should be completed in say 3 hours. The medical team should reach by this thing because the distance from the nearest hospital or the assembly point of the ambulance is this, and it should become. Just for example, by if they say within 10 minutes ambulance should come, because he have cross checked and we have assessed, asked, and it is not reaching, then he could easily compare that the thought process was this and what he actually achieved. This is anticipated response measures. An example of this exercise event and anticipated is a flow of chemicals at rapid rate. Anticipated response: first responders on the scene confer with the plant manager on to identify the chemical. Even if no intervention is required during exercise, the process of developing anticipated response will be valuable to the designer of exercise events. The set of anticipated response will provide a useful framework for discussion during the post-exercise evaluation, because already anticipated response have been crossed. They have cross-checked to identify the chemical, and as they know the identity chemical, they will easily run the MSDS. They will see the properties, and as per the properties, they will compare. Okay, these are the antidotes, these are the first aid, these are the measures which we have to take, and all these things will be taken care of. Guidelines for conducting exercise: the major preparatory steps discussed about the set stage for a smooth conduct of the exercise by the exercise facilitator. On the day of exercise, the facilitator must assume direct responsibility for the conduct of the exercise to ensure adequate accomplishment of the objectives. The facilitator's job is to describe the ground rules, including the roles of various participants, present the players with exercise narrative, announce the first event of the scenario, stimulate play responses without intervening in the way that assumes control the play, unless it appears that players will not intimate response, control the flow and pace of the exercise by introducing remaining events in the sequence, and keep the exercise on schedule and terminate play at the specified end time. Again, it is basically a system only which is much required. In general, it is the best to let the exercise play develop naturally with participants responding to prescribed event as the deem appropriate. However, some anticipated response may be so critical to the purpose of exercise that the exercise facilitator will have no intervene in the play to assure that they take place. The fact that such intervention is required will, of course, represent a very important lesson for the exercise participants and should be noted for further discussion in the post-site debriefing and evaluation. An example would be activation of an evacuation process. During the exercise, whose objective include testing of committee's evacuation plan, which we are already discussing, which could be a example. Coming on to our last slides, guidelines for conducting a post-exercise debriefing and evaluation. A post-exercise debriefing and evaluation can be valuable. These post-exercise scenarios sessions are critical for capturing the lessons of tabletop so that can be used to revise and improve emergency plans. Facilitator should conduct a debriefing session whose primary objective is to review the experience of the participants during the exercise, because it is much required that the professionals should say, okay, we have been given this role and we have tried, or this is the failure, this is a lacuna, this is a requirement which we can focus upon. A debriefing works best if the facilitator leads the participant to an event by event recapitulation of the exercise. He will tell, this was devised, this was planned, and we have done this thing, discussing the actual responses. The debriefing may cover all event responses before they are evaluated, or it may be proceed at one event at a time, allowing an opportunity for evaluation as well. Once the debriefing is completed, the facilitator should elicit evaluations from the participants concerning both their own performance exercise and characteristics of the exercise. The process is enhanced whether to find the fault with the performance of the participants. Sorry. These recommendations may include actions to improve emergency response plans, procedures, and equipment. It is important that problems in the response system be separated from problems related to specific exercise design or conduct, that is, scenario event that did not match the conditions of the community. Facilitator should allow opportunity for the participants to evaluate the exercise itself, and the facilitator should be alert to both the possibilities that participants may be more critical of the exercise than of their own performance, and facts the problems with exercise design conduct may have produced some response that do not reflect existing plans, procedures, and response capabilities. Improving response preparedness following the exercise. Results of the debriefing evaluation period, especially remediations, need to be implemented by response system. These results should be included in the ongoing planning and preparedness activities. Local planners should initiate efforts to revise existing plans and procedures. Example, revise notification procedures, clarify responsibilities for providing services, etc. Exercise planners should use evaluation of the exercise itself to improve future exercises, and all other parties to take actions appropriate to the roles in the preparedness efforts. Approximately 3 to 6 months following the exercise, the contingency plans and procedures should be reviewed to ensure that appropriate changes revisions were incorporated. List of probable appendix may be MAH unit advances preparedness through tabletop exercise, tabletop exercise control materials, tabletop ground materials, suggestions of the conduct table here, tabletop exercise. So all these should be there in the steps which we have to focus upon. Materials could be N, but yes, what we have to focus upon is much required in this scenario. Examples, there will be two tables for the participants at the exercise, one for on-scene participation, other for the EOC or command position. Participants will enter the exercise and specific events in the script unfold to represent those parties who should be involved in responding the event is real, because there are very much people who don't know that this is drill. They will participate as actual players and they will so certain things will happen. So these people are very much important, and the response from these people or community is very much required to make our plan better. It is important that participants do not enter exercise until they are normally or reasonably would do so. For each event, the appropriate participants will describe fully the actions that would take in response. Discussions as well as statements are encouraged, and it is important to try speak loudly and clearly to as possible for the benefits of those affected by the actions being described as well as the observers and recorders. It's a general statement, but yes, loudly and clearly is much required. It's a very crowded place when we go for the exercise part, and it should take into concern. The recorder, as I already quoted, will write down actions. These sheets will be later reviewed and self-evaluation portions. When a player's participation is no longer required at either table, the player should return to the observation section. The exercise facilitator may call a timeout in the exercise if technical advice or information is needed to assure the realism of the simulation. when anticipated responses which are critical to the purpose of the exercise are not carried out, the exercise facilitator may intervene in the play to assure that all takes all questions should be directed to the exercise facilitator, and comments by the observer should be made during the evaluation period and not during the exercise. So it is important that comments observation should be made during the evaluation period. During the exercise, nobody should say these people have to only focus upon the chart they have given, and they have to only tick chart or cross the chart whatever they are being assigned. So with this, thank you for today's slide. I think I'm open for the question part. So questions, please.
Sir,
I am not able to see the.
the Vizag event, chemical leak,
Yes,
or
yes,
the
ma'am.
styrene was this thing, the styrene gas, I think.
Yeah.
And there was a computer glitch which caused the leakage to happen to sometime during
Yes.
COVID, I think, and maintenance was not done.
Yes. Yes. Shut after the shutdown and open of the plant.
Yeah. So in
Reopen.
terms of,
Yeah.
so was this kind of exercise a practice before the Vizag leakage? And what is the, could you correct us to any reading material to see how was that handled and how well or ill it was handled?
You are telling that any drill was exercised in the Vizag or not,
Done.
ma'am?
Whether it was done before, and if it was done, how
Okay.
well or ill it was done, and by any
Okay.
connected reading material for us to see
Yes. Yes.
what
Okay.
all that
I
you,
will
what
share
all
the.
you have said,
Okay.
what all you have
Okay.
said
Okay.
was a deviation or adherence to all these procedures and SOPs that you have said.
Okay. Okay. I will share the report submitted to the government because I was also the part of that committee. So it will be shared to you. And the report you can easily compare, but as per my this thing, it is not very well excised. The what you say offsite emergency plan was not very well excised in the Vizag leakage. Even the company and the district administration was not aware of this type of scenario. They have never devised this type of scenario, and that's why it was a big problem. Even if I say the real part, in case of styrene leakage, it took around 4 to 5 hours to ascertain what the chemical is and what is the antidote of the chemical. So because they are not properly following, or they are not focusing on this part also, this can happen anywhere. It's not about the Vizag part also. In Delhi also, or any place also, it can happen at any place. So I will try to share the document, and I have the document. I will share.
Then also follow up in terms of
Uh,
review or revision of these plans. What were the NDMA instructions that were given to make good the shortfalls? I'm not talking about, I'm just giving an example of Isaac, but any such leak, what are the counter mechanisms that have been suggested from the government or by the NDMA, whichever is the authorized agency to do this?
In this case, basically it's a chemical hazard. So as per the directives, the Ministry of Environment, Forest and Climate Change is the nodal agencies. So and it is a chemical leakage, and it falls in MH installations only. So MSISC rules 1989 will cover. So they are penalized for this part. But this I have to check what Vizag disaster is a state subject, what that state have done. Just try to check, and then I can
You
revert
can,
you back
yeah,
after
kind
cross
of
checking that what.
refer us to that reading material also, so we get a complete idea of Vizag at least.
True, true, true. That I will share. The incident investigation report I will share to you.
Okay.
No issues for that. But what is the preparedness of state? It is a matter of fact finding. What this, because central government has recommended. Had they followed the directions from the central government, it is the thing which I have to check. Then only I can let you know.
Thank you.
Okay. Thank you, ma'am. Any other questions? Uh, I don't think anything in the chat box. I suppose there is no chat box. Okay, so Rohit, are you there?
Yes, sir.
Okay, so if there can you see any questions over there?
No, sir. No, sir. On YouTube, no.
No. Okay. 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 So thank you very much for listening. And as ma'am said, I will share the document to you. so that you can easily ascertain what actually happens in Vizag. It is a good investigation report which we all get some knowledge from that instance. So thank you very much, and a very happy Diwali to all of you. So Rohit, can you will
Yeah,
disconnect?
yeah.
Okay.
Yes, thank
Okay.
you.
Thank you.